Welcome to Counterpoint. I'm your host, Tanya Allen. Our Canadian healthcare system is routinely touted, almost in a Trump like fashion, as the best in the world. Canadians are proud and rigidly defend their healthcare system. But is it really? Is it really the best in the world? According to a newly released documentary by secondstreet.org, our universal healthcare system is really not that great, actually. In fact, compared to other developed countries with universal healthcare systems, Canada, in some areas, ranks dead last. Couple that with the fact that more than 6 million Canadians say they do not have regular access to primary care physicians, and it seems that our healthcare system is in deep, deep trouble. So, what are governments doing to solve the problem? What are some of the solutions for the ever growing crisis with an ever growing budget? Well, joining me now to discuss some proposed solutions and the Health Reform Now documentary is Colin Craig, president of secondstreet.org, the producer of the feature. Colin, thank you so much for coming on. I appreciate this topic, and I feel like every time you come on now, we're actually only discussing healthcare. But let's dial it back for those who may have not tuned into some of our previous interviews. For the layman watching, what kind of healthcare system does Canada have, and what other systems exist in the world?
Well, thanks for having me, Tanya. I always appreciate chatting about this topic because obviously it's so important, right? I mean, our health is our most important thing. And, to your question, we have, at least in theory, a universal healthcare system, which means that everyone is covered. The problem is that not everyone gets the care they need. We have a system that spends a lot of money. We have a lot of good people in the system. I'm sure everyone watching can think of a nurse or a doctor who they know they got into medicine because they want to help patients. They're good people. So we have good people in the system, at least a lot of them. We have a lot of money in the system. We have a structural problem with the system. The way it's designed and set up is not conducive to delivering the best results possible for patients. And too many people fall between the cracks, and that's the problem. Everywhere you look in the healthcare system, you play the waiting game. You
Mhm.
have to wait, as you noted, to get a family doctor. 6 million Canadians are waiting and waiting and waiting to find a family doctor. You go to a walk-in clinic, you have to wait there. You have to wait often long times to see your family doctor. You have to wait long periods at an emergency room, an urgent care facility. You have to wait long periods to get a hip or knee operation. I mean, we see this waiting game playing out throughout the healthcare system. That's the bad news. The good news is that there are actually lots of other countries with universal healthcare systems, and they perform better than Canada's. So if we copy what they do right, then we can start to improve the results here in Canada.
But I feel like it's almost as if you've been a broken record, Colin. This is not the first time you've come on and said, here are some things that we can do. Here are some countries very similar to Canada who have the similar system, and here's what they do better. Why
Mhm.
isn't our government listening?
You know, that's a great question. I think for too long, special interest groups have been able to halt any kinds of significant reform. Immediately, when someone talks about challenging the status quo and trying to deliver better care for patients, we see fear mongering. People immediately respond with, "Oh, you're Americanizing the system." They've painted this discussion as one of two options: the Canadian model or the American model. And really, what we show in the documentary is that obviously there's lots of other countries in the world.
Hmm.
Many other countries have universal systems like Canada, but they're delivering better results. So France, Sweden, Australia, I mean, there's so many other countries we could look to for leadership. And we really just need the courage now to do so. And one of the good things is that we've seen public opinion shift on this issue over the past 20, 30 years, where now Canadians are a lot more open to copying some of the best practices from these other countries so that we can get better care. And I think Canadians are very much warm to the idea. We haven't seen the political class move along yet enough. And we talk about that in the documentary.
And in the documentary, and again, I do encourage those to watch it who are viewing here. Uh, when you hear these stories of patients they're in tears because they couldn't access the care in due time and they are left with long-term challenges, or in some cases, you grieving family members who've lost a loved one because they sat on a list. And then, of course, the horror of having to get a phone call saying, "Oh, we have your appointment or your test scheduled." And the family member responds with, "Well, they just died a week ago. You guys are too late." We're going to pick up this discussion in just a few moments.